Hi, everybody. Thank you for joining our webinar today, The Iceberg That Can Sink Your Health Plan, Understanding the Impact of Chronic Kidney Disease on Health Plans and the Workforce. With us today speaking is Contessa Davis. Contessa is our integrated care nurse here at Rhinologic. She has an extensive background in nephrology with over 10 years of experience working with patients with CKD, end-stage renal disease, and post-transplant. She's worked with numerous CKD and ESRD patients across multiple states and also managed 9 home dialysis programs with over 130 patients. She graduated with her Bachelor's of Nursing from University of West Florida and was accepted into their Master's of Nursing program. With that, I will turn it over to my very experienced colleague, Tessa, as she takes us through what this important topic means and its impact on the population as well as managed care or insurance plans.
Thank you so much, Amy. I really appreciate that introduction. And thank you to everybody who has decided to take time out of their busy schedule to join us today for this webinar. Again, my name is Contessa Davis, and I am the integrated care nurse for Rhinologic. I am going to be talking to you a little today about chronic kidney disease and the impact that ESRD and chronic kidney disease can have on members and the manifestations that occur when a member is having issues with their kidneys. I'm going to go over briefly about kidneys and what they are, what they do, the importance of the kidneys and the functions that they have. And then also, whenever those kidneys start to fail, the manifestations that can occur. And it can not only affect the member, but it can also have significant impact to the employer and to the self-funded health plans. Many times, especially in advanced stage kidney disease, high cost claims occurs with individuals that are in CKD, stage 4, stage 5, and ESRD. And so today we're going to be discussing how to protect your plan against those high cost claims, and also for the member side, how to prevent CKD from occurring. So let's talk with the kidneys. So a little bit about your kidneys. Your kidneys are 2 bean-shaped organs that are located on either side of the spine. They are the size of your fist, roughly, and they are between 9 to 11 centimeters. And even though they are small organs in comparison to other organs that are in the body, they are very complex organs and they do many, many things. Some things that they do that we're going to be discussing a little bit today is the removal of waste. I know that many individuals, when they think about the kidneys and what they do, that is the first thing that's top of mind to them. Like, oh, they make urine, they get rid of the waste. And that's true. They do that. However, there are many other functions that the kidneys do that play critical roles within the body. One is making sure you have enough red blood cells within your blood. This helps to prevent anemia. Another thing is making sure your bones and your teeth are healthy and strong through calcium and phosphorus balance within the blood. And again, those are all very important things that the kidneys do, and just some of the things that the kidneys do in comparison to the kidney function as a whole. So how does the kidneys do that? How do they do their job? Your kidneys are the filter of your body. You have 2 of them, and so when one starts to fail, there's the other one for your backup. However, over time, if one starts to fail, the other one overcompensates, and it can lead to that other one also failing, which can lead to certain stages of CKD and end-stage renal disease. So with that being said, your blood is filtered through your kidneys. The unfiltered blood goes through your kidneys through the renal artery, and it passes through the working house of the kidney, which is the nephron. The nephron is the filtering unit of the kidney itself. And as that nephron is working, it is removing waste, extra fluid, byproducts that your body does not need anymore, and it's converting that into urine, where it's then being excreted through the ureter down to the bladder, where it is stored until you are able to void. Now, whenever that blood is being filtered and that excess stuff is being removed that you don't need, the good stuff that you do need, the protein, the vitamins, the nutrients, the extra electrolytes, even extra fluid that you may need is still being diverted into that blood and it's going out through the renal vein through the rest of the body. And a little fun fact at the bottom is your kidneys are returning about 200 quarts of fluid every 24 hours in your body. So 200 quarts is equivalent to 50 gallons. 50 gallons of fluid your kidneys are processing and filtering every 24 hours throughout the day. Your kidneys do not have a day off, just like your heart, just like your brain, just like your lungs. They are small, but they are absolutely mighty in their function in your body. So going back to what the kidneys do, we talked about the removal of waste, which is the majority of the things that pops into people's mind when we discuss about the kidneys. But the kidneys do remove extra waste and extra fluid that's accumulating in the blood. However, they also are removing things that are naturally occurring within your body. Everything you eat, everything you drink, everything you digest is being broken down. And what you need to maintain yourself to be healthy, your kidneys is going to maintain that in the blood. What you don't need is going to excrete that through the urine. And it does that continuously. But what other people don't understand is that there's other processes that are happening within the body that is making the kidneys work just as hard. Everybody has some degree of muscle turnover, and that degree is going to be determined on whether or not you are a male or a female, whether you are a young person or an older person, whether you have a significant amount of muscle mass because you're a bodybuilder, or whether you are an 80-year-old lady just doing her errands. That is going to determine how much muscle turnover and how much muscle mass is occurring within your body. Muscle turnover is something that is natural, and it occurs in every person that is alive. And so when that muscle is turned over, it creates a byproduct called creatinine. And that creatinine is not toxic by itself to the individual. However, whenever the blood level of creatinine gets above a certain level because the kidneys are not functioning and it's not excreting that creatinine properly, that's whenever problems arise. And then whenever you are ingesting things and you're breaking it down on a molecular level, your body is getting rid of the things that it doesn't need. When you ingest food, when you ingest drinks, it's broken down into nitrogen, and that nitrogen is being excreted through your urine. When that nitrogen starts to build up, or that creatinine is starting to build up in the blood because the kidneys are losing its function, that is whenever you start to have significant issues within the body. And that can cause uremia. Uremia can be manifest through dry, itchy skin, through nausea, through vomiting, through loss of appetite, shortness of breath, fatigue. All those things are signs of something may be going on with the kidneys that need further investigation. So your kidneys maintain your healthy bones and your healthy teeth. Another thing that individuals are not aware of is that your kidneys are responsible for calcium, phosphorus, and vitamin D balance within the bloodstream. With a healthy kidney, when you eat anything, phosphorus is going to be in it. It's what we need for our teeth, it's what we need for our bone. And so, with that phosphorus, whenever it starts to accumulate in the blood and we don't need it, your kidneys will start to excrete it in the urine of what we don't need or what we don't need to be stored. And the same thing when it comes to vitamin D. When you ingest something, when you eat something that has high amounts of vitamin D in it, that is the inactive form of vitamin D that you are eating. It is only until it reaches your kidneys that it turns it into an active form that your body can use for your teeth and for your bones and for other body functions that are going on. So, with diseased kidneys, that phosphorus starts to accumulate in the blood instead of it being excreted. So you're having high phosphorus in the blood, along with low levels of vitamin D because your kidneys aren't able to activate it into a usable form, which leads to low levels of calcium. All those things combined turns on your parathyroid gland, which sits above your thyroid gland, and it starts to excrete a hormone called PTH, or parathyroid hormone. And whenever that happens, because the calcium level in the blood is so low at that time, your parathyroid hormone stimulates osteoclasts to go after the bone and the teeth to break down the calcium that is within those structures to put it into the bloodstream to try to balance and counteract what is going on within the body. And this is very dangerous because this can lead to osteoporosis, which makes it easier for people to have fractures and breaks. This can also lead to um, um, dental issues with members that are having this going on. Also, with a high amount of phosphorus and stuff that's going on within the body, it can start to deposit on the blood vessels and cause those blood vessels to become hardened, which leads to all kinds of cardiovascular issues, heart attacks, and everything else that can occur within that member. When it comes to kidney function, your body is your kidneys are responsible for making sure that you have enough red blood cells. Um, Whenever you have a healthy kidney, it replenishes or it creates a stem cell called erythropoietin, and that stem cell talks to your bone marrow. Again, like what we talked about with the muscle turnover, have you're constantly having your muscles tear up and build up. Throughout your day, throughout your life. It's the same thing that happens with your red blood cells. Your red blood cells last between 115 to 120 days in a healthy individual, and they die off, and that's normal. Your kidneys are responsible for telling your bone marrow to, hey, wake up, make more red blood cells. I'm starting to die off. And it does that continuously to where your levels are maintained at a rate to where you don't become anemic. Now, whenever you have chronic kidney disease, especially in advanced stages, that signal is cut off. That erythropoietin signal is cut off. It is not telling the bone marrow to make more red blood cells. It is the red blood cells are dying off at a faster rate and they're not being replenished because that signal isn't being sent to the bone marrow. And this causes anemia to occur. And in some cases, if a member is having this happen, they would need blood transfusions, certain medications to help stimulate um, synthetic erythropoietin to stimulate the bone marrows to reverse the anemia that is happening within that member. So we talked a little bit about the kidneys and the certain functions that happen and what they do. Now we're going to talk a little about chronic kidney disease and end-stage renal disease and the manifestations that happen whenever members are starting to battle these diagnoses. So as we stated earlier, your kidneys filter your blood. They remove all the bad stuff and to make it into urine, and they keep the good stuff that you need for it to go back into the blood. With a diseased kidney, the toxins, the extra waste, all the things that you do not need that needs to be filtered out of your bloodstream gets put right back into the bloodstream that carries into the other organs. And this can cause significant issues, not just related to their kidneys, but into other organ systems as well. Chronic kidney disease is characterized by the gradual loss of kidney function. This happens over time. It doesn't happen suddenly, as in acute kidney injury or AKI. That is the sudden loss of kidney function, which occurs usually by a traumatic event, such as a motor vehicle accident. Somebody loses a large amount of blood at one particular time, or it can happen through certain medications that are nephrotoxic that can cause AKI episodes. Chronic kidney disease is completely different than that because in versus AKI, those issues usually resolve within 90 days or less. But when you have someone who has CKD, that occurs gradually in those stages, and it goes through those different stages continuously throughout someone's lifespan. Now, can it halt? Can we slow the progression? Can we reverse some of the damage that is done? Absolutely. But it has to be caught early and it has to be well managed in order for that to happen. If that does not happen, CKD can progress into end stage renal disease, which is the last stage of CKD. There are 5 stages of chronic kidney disease or CKD, and it's characterized by the glomerular filtration rate. Now, this is a blood test that any physician can do that usually is performed with your annual labs and physical. You go in, the doctor takes your blood sample, and it is characterized by your GFR, which is a percentage. And that percentage correlates to how much kidney function is left intact. Is that 90% is left intact? Is that 60% is left intact? That percentage number lets that doctor know, okay, this member has a GFR of 44%. That means 44% of your kidney function is still intact. I need to go ahead and refer you out to someone, a nephrologist who specializes in the kidney function, because that way more intensive treatment and more intensive care can happen to hopefully reverse the damage that has been done. But if it cannot be reversed, then to slow the progression of it. Once someone reaches CKD stage 5, they are considered in kidney failure. That means that 15% of their kidney function is left. And in that case, when they hit that stage, renal replacement therapies such as dialysis therapies must begin and must continue until that person either gets a transplant or chooses to remove therapies altogether. So what is the impact that CKD has on the member? There are many, 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 but today we are going to discuss what the impact it has on the member physically and financially. So the CKD physical impact on the member, as what we had discussed earlier, can manifest in many different ways. They can be tired, lethargic, have shortness of breath, itchy, dry, itchy skin, that type of things. And chronic kidney disease is such a major, major concern because many times these individuals are asymptomatic until they are in latent stage CKD, meaning that they have no symptoms whatsoever until they are in CKD stage 4 or in CKD stage 5. And at that time, when they hit those stages, they're no longer able to reverse the damage. They're only able to slow the progression. They're only able to prepare that individual to start dialysis. They're only able to refer that individual for a transplant. And that is where the high cost claims occur, is during that time. 1 in 3 people in the United States do have a high risk of developing CKD. And certain risk factors that happens that lead to CKD is the number 1 cause, which is diabetes, and the number 2 cause, which is hypertension. According to the National Institute of Health, 1 in 3 diabetics will have some form of CKD in their lifespan. And 1 in 5 individuals with hypertension will have some form of CKD in their lifespan. That is significant, especially since a lot of times people don't know that they're in CKD until they're in advanced stages. And during that time, that's when the high cost claims occur. If you have heart disease that's within your family, or if you have heart disease, that's also a major risk factor of developing CKD. 25% of what the heart pumps goes directly to the kidneys. And so if you have issues with your heart, it will directly affect your kidney function as well. Do you have any family history of CKD or dialysis, or people that are needing transplant? Are you obese? Obesity leads to diabetes and it leads to hypertension. That is something that has been studied and shown. And like how I said before, diabetes and hypertension is the number 1 and number 2 cause of kidney failure. CKD can manifest itself in many, many ways. And again, as I said over and over again, it usually doesn't happen. These signs usually doesn't occur until they're in latent stage CKD. And sometimes they don't occur at all. I've had many patients that that were in CKD stage 5, so technically in kidney failure, who did not have any symptoms whatsoever. They felt perfectly fine. And that's very, very dangerous for the health of that member and very costly for the member and for the health plan. Some manifestations that can happen with CKD is pressure, swelling in the hands, legs, feet, face, tummy, frothy or foamy urine. And that's because the protein is being spilled out into the urine. With normal kidney function, when that blood is being filtered, it keeps the protein within the blood. We need, or they call it albumin. They keep that albumin, which is the protein in the blood. Whenever you're starting to have protein or the albumin spill over into the urine to create that frothiness, that is a clear sign that there is something going on with the kidneys. Also, the anemia, what we talked about before, because of that, erythropoietin isn't being created as it was before. The nausea, the vomiting, and also the decreased appetite, and those are signs of uremia from CKD. So the financial impact that also occurs for a member that has CKD, you have increased costs because of copays, especially those that are in latent stage CKD. CKD stage 3 on up are being referred to nephrologists for further evaluation and care. They are specialized physicians. So whenever you are seeing those type of physicians, especially if they have diabetes, they may also be seeing an endocrinologist. You have those copays along with the medication copays from the pharmacy that you now have to take because of you now having CKD. You will also, a lot of times, people that have CKD will also have greater incidence of hospitalizations. According to the National Institute of Health, people that have CKD are 2 times more likely to go to the hospital and the ER versus someone who doesn't have CKD. And so, on top of them having bills from their nephrologist, from their endocrinologist, medication that they now have to take that are very, very costly, now they have more bills from them going in and out of the hospital. Many of these members have to adjust their work schedule because of them being sick, or for those that have to start on dialysis, they have to adjust their work schedule as well. The caregivers of these individuals sometimes have to go on FMLA, especially if they decide to go on a home dialysis modality, so that they can continue working. They still have to take off of work in order to be trained effectively and efficiently, so that they are able to do their dialysis at home versus going in center 3 times a week. And depending on the type of home modality that this individual chooses, they may have to be off of work anywhere between 2 to 6 to 8 weeks, depending on the modality that they choose. So they do have significant financial impacts that can occur depending on the stage of CKD that they are in. We've talked about the impacts that happen for members that have CKD. Now we're going to discuss the cost that goes along with it. The cost is not only to the member, but also to the employer and the health insurance plan. This graph shows CKD, the percentage of adults that are aware of their CKD stage. And this goes to what we had discussed before, that many people do not know they have CKD until they're in late stage CKD. So as you can see from the graph, individuals that have CKD stage 5, where they 90% plus are aware. And there is a huge gap, as you can see, between this brown line, where it's CKD stage 5, and this blue line, which is CKD stage 4. There is a huge gap. And that is a huge gap when it comes to people who are unaware that they have CKD stage 4. And there's an even bigger gap between those that have CKD stage 4 versus those with CKD stage 3, 2, and 1. Although there have been advances in treatment for people that have CKD, so it slows the progression where they don't develop ESRD, and more treatment when it comes to trying with medications and diagnostics that can help early detect if someone has CKD. There is still a huge variance of people out there who do not know that they have this disease. And that's very, very concerning. ESRD numbers are rising at least 20,000 new cases every single year. And unfortunately, even though we're having these breakthroughs, it's still becoming more and more of an issue, both for the member and for the employer. The financial impacts for the employer, for the health group, for someone who that is taking care of a member, or that has a member that has end-stage renal disease, can be extremely devastating. As you can see from the graph, there is an over $10,000 difference, monthly spending difference for patients who have end-stage renal disease versus those who do not. And that is huge. That's a huge amount of money. That's a huge variance. And that has to deal with the treatments and the medications and everything that goes along with taking care of someone with end-stage renal disease. Um, the greater someone is in stage of CKD, the more costly it's going to be to the member and to the employer as well, and to the health plan. There is no cure for end-stage renal disease. There's only treatment. Even transplant is considered a treatment. It is not considered a cure for end-stage renal disease. And so you have 786,000 people in the United States that have some form of ESRD, and 71% are on dialysis, with 29% receiving a transplant. Um, I was reading a book from UNOS and a report that came out recently that last year 100,000 people were on the waiting list for a transplant and only 6,500 received. So that's a huge gap. And that means that these individuals can be on this treatment on dialysis, hemo, in-center peritoneal dialysis for many years before they actually are transplanted, accumulating that month over month, $10,000 a month treatment rate, which can be, again, devastating for the member and also devastating for the employer and the employer group. So, what can be done? There are going to be people that are going to go on dialysis. There are going to be people that are going to develop CKD. So, what can we as an employer group, what can I as an individual do to prevent CKD from occurring, and also to try to minimize the impact that happens whenever you do have someone who does start on dialysis? From the member's perspective, um, doing your annual lab test every year is the cheapest, most most effective way of preventing and treating and catching CKD. Again, that glomerular filtration rate, the GFR, that blood test that can be done can detect when there's issues to the kidneys early, and then be referred out if they have CKD to a nephrologist early to hopefully reverse the damage or at least slow the progression. If someone has CKD, depending on what stage they are in, it's going to determine how often they go to the doctor. And this goes back to what I said earlier, as far as the more advanced stage that person is in when it comes to CKD, the more costly it's going to be to the member and to the health employer group. And that's true. They're going to be seeing their doctors a lot more, someone with CKD stage 5 versus someone with CKD stage 3. Certain things that the members can do to help protect your kidneys, especially if you already know you have some underlying form of CKD, is limit the use of NSAIDs, non-steroidal anti-inflammatory drugs. This is Aleve, this is naproxen, aspirin. All these medications have been proven to cause significant issues to the kidneys and can cause kidney failure if taken over a long period of time. So if you have a member that is in chronic pain or is dealing with issue that is not related to kidneys whatsoever, but they are taking NSAIDs for that condition, they absolutely need to be monitored by their physician to make sure that they're not causing any damage to their kidneys. Making sure you are limiting your alcohol consumption, quitting smoking is a big one. What is good for the heart is going to be good for the kidneys and vice versa. Smoking can dramatically progress CKD to an advanced stage if a member, especially if they already have it, with them continuing smoking. Staying well hydrated, and this goes for people to help deter from kidney stone formation. So making sure you're staying well hydrated, making sure you're drinking lots of water and fluids. If you have a member that has diabetes and or hypertension, making sure that they are seeing their primary care doctor or their endocrinologist on a regular routine basis. For people with diabetes, it is recommended that they see their doctor, their endocrinologist, quarterly to monitor their hemoglobin A1C levels. With people with hypertension, it is recommended that they see their doctor at least twice a year, just to make sure that their medications and everything that they are taking, their blood pressure measurements are within parameters, so that kidney issues do not develop or even become worse. As an employer, what can you do to minimize the impact? We talked about the member. So, as an employer, what can you do to minimize the impact that can occur with these high dollar, high cost claims associated with CKD? Investing into programs such as Impact Care can help with that. We have registered nurses that are specialized in helping individuals with case management, especially those that have diabetes and hypertension and those that already have some form of CKD. We have certified diabetic nurses that can help manage the members' blood sugar levels so that they can slow the progression of CKD. We have specialized nephrology nurses that can help manage members who already have CKD as a diagnosis. We are 99.7% effective in fighting against and preventing dialysis, which is huge because as you can see from the graph there, Medicare versus individual markets, commercial insurance. You can see the huge difference there is when it comes to costs of outpatient dialysis. On one hand, you have the individual market paying over 10 grand and Medicare paying $3,300 or less a month for these in members. And that can be extremely impactful. And if you are having members that are high risk or having members that are on dialysis, putting into place stop loss coverage through our plan, through Renalogic's Impact Protect plan, can help to minimize that impact, financial impact, whenever you do have members who have to start on dialysis or members that are in advanced stage CKD. Providing health and wellness programs as well can also help to try to prevent CKD from occurring or slow the progression. And again, that's with on-site annual health screenings, that's with smoking cessation programs, weight loss programs, discount fitness gym memberships. Things like that have been shown to improve the health of the member so that we can hopefully deter against some of these high cost claims that occur with CKD. So, in conclusion, kidneys do play a vital role in our overall health. They have many, many functions. Individuals with CKD and with end stage renal disease are very prevalent in the United States, with 1 in 3 having a high risk of developing CKD, and 9 out of 10 individuals who have CKD not knowing what stage they are currently in. And the impacts of that can be devastating, not only for the member, but for the employer group. And but even though that can happen, even though those things can happen, even though you may have a member that has advanced stage CKD or have a member that's about to start on dialysis, certain things can be done to protect that company, to protect the assets and the health plan of that company. By investing in Impact Care, Impact Protect, it can greatly minimize the cost of CKD and dialysis, which in overall will help the company and the member. If you ever have any questions or if you have any inquiries as far as the um, different things that Renalogic can offer, you can always email us at sales@renalogic.com and we will happily assist you. And that concludes my webinar. I think we have some time for questions.
And Tessa, thank you. That was a really informative presentation. Really appreciate your input. We do have some questions that came across. First one, what are your thoughts about home dialysis?
That's a great question. Home dialysis is, I think, one of the best treatment options for someone who have end-stage renal disease. It not only keeps that member working, which is important for not only their health and for the financial future of their family, and also for that employer, but it also correlates to in-home dialysis correlates to that member having better health outcomes, better lives. It has been proven and shown that members that are on peritoneal dialysis or home hemodialysis have better health outcomes to those who are on in-center dialysis. And so I'm a huge advocate for home dialysis. And whenever it comes to the financial aspect of it, it is cheaper in cost versus those that go in center to the member and to the employer. So it has many different benefits, and I am 100% an advocate for home dialysis. That's a good question.
Awesome, thank you. Another question that came in, is CKD reversible?
CKD is reversible as long as you catch it early, like what we had discussed earlier. Unfortunately, in many cases, that's not the case. But if an individual is seeing their doctor every year and having labs drawn, if they detect it early, if they're in CKD stage 1, stage 2, and even in CKD stage 3, sometimes it can be reversible. And also, it has to deal with the cause of the CKD. Did you get to CKD because you've been taking NSAIDs or Aleve or aspirin because you have severe chronic pain? If that's the case, maybe the removal of that medication and the healing of that kidney can then be reversed. But again, you have to remove that source. If it's caused by something of a chronic condition such as diabetes or hypertension, which causes damage to the kidneys over time, um, a lot of times those are not reversible. However, the damage to that kidney can absolutely be slowed down as long as they're receiving proper care and proper management of that disease state, whether it's hypertension or diabetes.
Great, that's helpful.
Yes.
Here's a question from an employer. As an employer, what can I do to help my employees be better engaged in our health and wellness programs?
That's a great question. I know some employers provide incentives, whether that's discounted rates off of their health insurance, whether that's a gift card, Visa gift card or whatnot. Sometimes I know employers do different challenges with their employees as far as who can lose the most weight or who can improve their health the best, and then they win some prize or whatnot. Those are all good ways to have people be more engaged in taking care of themselves. And then also making things easier for that member. Having an on-site annual screening is hugely successful, even if you don't have the capabilities of having an on-site clinic, but having a place that an employee can go annually that's free and that is close by and that they have easy access to in order for them to get their labs drawn so that things can be detected early is also a great way for them to stay engaged for their health. It's a good question.
Those are all awesome suggestions. Okay, so here's a question. Are herbal supplements okay to take if I'm on blood pressure medications?
Um, Herbal supplements is definitely a hot topic because there's so many that's out there, right? There's so many that is marketed day in and day out on social media, TV, etc. What I will say about herbal supplements is that your doctor needs to always be aware of what you are taking when it comes to herbal supplements, because some herbal supplements can interfere with medications, especially blood pressure medications and heart medications. So, and you don't want that to happen. And some of them can become toxic as well in taking a large amount. So, when it comes to herbal supplements, I'm for herbal supplements. I take them myself. However, you need to make sure that you are consulting with your physician before you start taking any herbal supplements.
Good advice. Always loop in the physician to that with those things.
Absolutely.
And then the last question we got here was, what are some diet tips you would give to somebody with high blood pressure and or CKD?
That's a good question. Some diet tips I would get for high blood pressure. So, of course, you want to monitor your salt intake. You never want to have a high salt diet. That salt clings to fluid within your bloodstream and it causes it to basically act as a magnet to where it doesn't want to let it go. And that increases your pressure. So, making sure you're maintaining a low sodium diet, a low sodium diet, and sodium can also be found in certain things that you drink as well. A lot of diet sodas, people say, "Oh, I'm doing well. I don't drink a bunch of soda, and what I do is diet soda." But diet sodas have a lot of sodium in it, and many people are not aware of that. So just being mindful of what you're eating and what you're drinking, consulting a dietitian A lot of doctors' offices now have registered dietitians within their offices that can help with that. People that have advanced stage CKD stage 4, CKD stage 5, um, it has been shown that more of a plant-based diet has helped with that, and especially with the symptoms of CKD. And again, that's something that you would need to talk to your doctor about, because with the plant-based diet also comes higher levels of potassium and different electrolytes as well. But the plant-based diet has been shown to be gentler on the kidneys versus a more meat-based diet per se. And so that's something that has helped people with advanced stage CKD. But again, that's something that you would definitely want to discuss with your physician. It's a good question.
Great information, Tessa. I always learn something new from you every time you speak. Wonderful to have you as a speaker on a webinar today. If anyone wants more information about Renologic, feel free to email us at sales@renologic.com or visit renologic.com, the website, and there's contact forms on there as well. Thanks everybody for your attendance, and we'll see you next time.
Thank you.